Exploited, the Cyber Truth, a podcast by RunSafe Security.
Welcome back, everybody, to Exploited, the Cyber Truth. I am Paul Ducklin, joined as usual by Joe Saunders, CEO and founder of RunSafe Security. Hello, Joe.
Greetings, Paul. Great to be here, as always.
Yes, thanks for joining us. I know you are on the road once again. Now, we have a super special guest today, and that is Greg Garcia. And our topic for today is, it's quite a dramatic sounding title, but a very important one. And Greg is here to help us discuss the issue that the next cyber crisis might not be one hospital, it could be the entire health system. So that's pretty dramatic. Let's hope it doesn't come to that. Let's hope we can advise people on how to prevent it coming to that. But before we kick off, Greg, you have quite a long and complicated job title, and you have an illustrious history in cybersecurity. So why don't we kick off by you telling us what you do now, where you come from, and what your aim is for cybersecurity in general and for healthcare in particular.
Be glad to. Thank you, Paul and Joe. Glad to be here. I'll keep my title simple. Basically, I'm the executive director, chief cook and bottle washer, right? I am the executive director of an industry coalition called the Cybersecurity Working Group of the Health Sector Council. Basically, what that is, the Sector Coordinating Council is an industry organized, industry managed advisory council to the government and to ourselves about critical infrastructure protection. Healthcare is considered critical infrastructure, just like electricity, telecommunications, financial services, water, oil and gas, everything that the public depends upon. So we have this formal public-private partnership between industry and government to work together on critical infrastructure protection. And for my group specifically, cybersecurity. Cybersecurity is it. So we have almost 500 organizations, private sector organizations across the spectrum of the healthcare sector, not just the hospitals, but the medical device companies, the pharmaceutical labs in blood, the health IT, and the payers, the health insurance plans and payers. And public health. So all of these work together in a interconnected ecosystem. Cyber threats are a cross-cutting challenge, and therefore it's a cross-cutting responsibility. And before this, I come at this not as a healthcare expert, not even as a cybersecurity practitioner. I mean, I've been doing cybersecurity for more than 20 years now as someone who's trying to bridge the public policy, the government side, with the technology of cybersecurity and the industry side of all of these different businesses that constitute critical infrastructure. So before this, I actually ran the same kind of sector coordinating council for financial services. Before that, I was the nation's first assistant secretary for cybersecurity for President Bush, appointed by the president in 2006, where I had visibility across the entire spectrum of critical infrastructure. I worked with all of those industry sectors, critical sectors, on addressing those cross-cutting cybersecurity challenges that affect these critical sectors because we are also interdependent, right? I can't do healthcare without water. I can't do healthcare without electricity or telecommunications. So you can build this complex web of interdependencies across the nation's critical infrastructures. And that's partly what Department of Homeland Security's job is. And so before that, I had time in the high-tech sector as a government affairs executive with a various number of trade associations representing that industry. I spent time in the U.S. Congress. So the first bill I ever wrote became law. I was a staff member on the House Science Committee, the Cybersecurity Research and Development Act of 2002. Not many congressional staffers can say that they've ever had a bill that they've been involved with pass. So I'll put that feather in my cap. But it's been a long and a rich career that has enabled me to make those connections across business, technology, national security and government policy. So it's a never-ending challenge as a national.
It is, isn't it?
Yeah.
You know, there's that famous saying that a journey of 1,000 miles starts with a single step. But when it comes to cybersecurity, particularly in an industry and as diverse as and as important as healthcare, it's more like a journey of 1,000,000 miles starts with a journey of 1,000 miles, which starts with a single step. So
yes, and a single step, it would be best if I were an octopus, because one step would be 8. So at least I'd be having an order of magnitude greater of what that first step constitutes. But yeah, I think that's well put, Paul.
Now, Greg, one thing that I've noticed, and fortunately I've never had to go to hospital in the United States, not because you have bad hospitals or anything. I'm just saying that I've only ever been in the US either as a visitor or on a brief business trip. And if you're going to end up in hospital, doing so 1,000,000 miles from home is the worst possible outcome. But certainly in my, visits to either as a patient or visiting other people to hospitals in the UK, they are an astonishing mix of IT and OT, aren't they? Much more so than a factory where you might have offices that are adjacent to the factory where people are working in regular IT systems. Then when you go into the factory, it's welding machines and cutting machines and industrial robots and stuff. And it's almost sort of the two don't meet. But when you're in a modern hospital, you've got all these fancy gadgets that are electronically controlled. Plus, you've got doctors and nurses running around with laptops connecting via Wi-Fi to the regular IT system. And the two interoperate in a way that at a scale that may not be the case in almost any other industry. Would you agree with that?
I would, although coming from the financial services sector and a major global bank, you say, well,
yes,
a bank is really a technology company that happens to move money around. Not just a company that buys technology, but they're so big and sprawling and specialized that they roll their own. They develop their own software for their own purposes. It's not quite as sophisticated as that in the healthcare system, but yes, the modern hospital is a technology organization that happens to do patient care. And that technology is being used to run medical devices, to run payment systems and patient data and scheduling systems, diagnostics and imaging. All of these capabilities are digitized. And yes, the nurses and others who carry around their laptops that are connecting to the hospital network, all of these points, all of these endpoints need to be protected in some way. So that's the job of the Chief Information Security Officer.
And I guess like the aerospace industry or the self-driving car industry these days, and I guess the financial sector as well, hospitals and the healthcare industry, although they're expected to be very innovative and have the latest and greatest gadgets, and they're also understandably very strictly regulated for obvious reasons, because if a machine goes wrong, it might not be that it doesn't complete your loan application in time. It might actually kill you.
That's exactly right. The American hospital system has a number of regulatory requirements. Most prominent is HIPAA, the Health Insurance Portability and Accountability Act, and it has the HIPAA security rule. So that requires hospitals to employ various security measures, and it requires that they practice downtime procedures, incident response capabilities. But even then, this is an industry that, with the exception of a few very large national or regional health systems, much of the healthcare industry consists of smaller, rural, critical access, under-resourced urban health systems, whose margins are, 0 to negative. And
absolutely,
when you have regulatory requirements that involve sometimes significant costs, like cyber tools, outsourcing to manage security services, hiring the right people, it gets expensive. And when you're a hospital administrator, you've got your choice. Do I hire another nurse? Do I upgrade my MRI machine? Or do I invest in cyber? Cyber? Cyber, what's that? I'm sorry, I have patients to take care of. Absolutely. So these are, this is the type
that really does focus your mind very differently, doesn't it?
Yeah.
You think, well, we might get attacked, but we could get attacked anyway. What we can't afford not to do is to care for our patients.
Right.
So
and,
and for the juggling act is
for the cyber person, it's sort of, the cynical thing to say, the harsh thing to say is, look, Doc, hope is not a strategy. That's hoping that you won't get hacked is not a good risk management strategy. So we have a ground truth, an organizing imperative in the Cyber Working Group, in the Sector Council, that cyber safety is patient safety. One of my member CISOs, Chief Information Security Officer, told me a story that they tried to get this point across to, maybe it was the chief surgeon. It was somebody very senior in the hospital system who was a doctor. He said, look, I can't be bothered with cybersecurity right now. Look, I've got 20 patients a day to take care of. To which the CISO responded, 20 patients. You're very busy. You know what? I have every patient in this hospital system to worry about. Because if I am not securing our network, if I'm not securing our medical devices and the patient data and all of the other OT, operational technology like refrigeration, HVAC, elevators.
Yes, it's not just the CT scanners, is it?
Exactly. It's the whole thing that makes the hospital work. If it's connected over a network, Doc, then it gets hacked and disrupted, and it goes dark. Sorry, you're not serving your patients. You're not taking care of your patients. So I'm responsible as a CISO for every patient in the hospital. Let's look at it that way. And I think that was persuasive to the physician, that this is something that actually does involve his or her responsibility. It is cybersecurity is everybody's responsibility at different levels of complexity.
And within that, of course, just given the scale of the healthcare system, when you talk about those different, all the patients that one hospital serves, but you talk about all the technology that's involved and all the suppliers of technology into each hospital system. But you look at healthcare in general, it's about just under 1/5 of U.S. economic activity. And so it's a massive industry and if you add up all those hospital systems across, the country, and all that technology and all those suppliers that supply that technology and all those medical devices that get deployed, you could see this is with good reason why this industry is part of the critical infrastructure and so vital to our own economic, activity in the U.S., but also just the safety and the health of Americans. And so it's a massive challenge to think about security across an entire country that does so much healthcare activity.
Yeah, it is. And it sort of reminds me of, we talked earlier that the healthcare industry is regulated. There are a lot of critical infrastructure industries that are regulated. And regulation can be, setting minimum standards is good. Sometimes the government gets a little bit too ambitious and they start saying how you should do things and starting to micromanage. That can actually be counterproductive. But, one of the things that the health system, particularly the health providers, have been calling for is greater accountability among those third-party technology and service providers, essentially many of them in the high-tech industry, that are not regulated. And it's very difficult to regulate cybersecurity standards, how you build it into devices and software. But we argue that, and I have testified before the Congress when they ask, well, what should we do? to be helpful? Well, Mr. Chairman, we have a healthcare industry that is heavily regulated, yet the technology that they must buy, the services that they must buy, is not regulated. Often that technology and those services are not adequately secured against cyber threats. Yet they can continue to sell to us, and we don't have other alternatives. Well, shouldn't it be a fair policy of the United States that any third-party technology and service provider serving any critical infrastructure? What is critical infrastructure? It has a definition. It means life or death. Not in all cases, but certainly in electricity and water and chemicals and transportation and healthcare. If you're a technology provider supporting a critical infrastructure, you ought to be held to a higher standard of cybersecurity, because cyber threats aren't going away. And if you are the vector, if you are the portal, your technology through which an attack is successful against a hospital system that disrupts operations and harms patients, you need to figure out how to better serve your customers. And by the way, we are all patients.
Yes.
So
this is really a special case of managing the supply chain, isn't it?
Yes.
Now, I know, Joe, we've talked several times on this podcast before about the automotive industry. Even traditionally, before everything was software defined, even when it was, you just mechanically manufactured brake calipers, for example, you have to account for at least 4 levels deep in the supply chain. It's not just enough to say, oh, I bought this from X, who I think's okay. You have to know that what X bought from Y is okay as well, and what Y bought from Z, and so on. Do you think we need regulations of that sort in the healthcare industry? And can we get those regulations without damping down innovation and without leaving healthcare maybe less advanced than it might otherwise be?
Yeah, this is a great question in terms of the security of the supply chain, and I might take a moment to answer this. But first, we have a tool for that. How we design a policy framework around regulating something as complex as a global supply chain, both in terms of software and services and technology and devices. You can go to our website at healthsectorcouncil.org. In the search field, type in SMART, Sector Mapping and Risk Toolkit. What I think much of the U.S. Healthcare system is very well aware now of this company called Change Healthcare. I'm not going to throw anybody under the bus, but Change Healthcare is one of those critical services and utilities that healthcare depends upon. What does that mean? I'm a patient. I walk into the doctor. The doctor gives me a prescription. The prescription needs to go for prior authorization by the insurance company. Are we going to pay for it or are we not? Is it necessary? Is it not? Yes, it's necessary. Great. I go to the pharmacy to pick up my prescription. I pay a lower cost because the insurance covers the other cost, and the insurance company then pays the doctor. So the insurance company, through this portal called Change Healthcare, it's just a technology platform. Change Healthcare handles that prior authorization communication, and it handles the reimbursement. What happened? Change Healthcare got hacked in February of 2024. It went dark. Change Healthcare serves 1/3 of the healthcare system. How many people?
Was that a ransomware attack?
Greg? It was a ransomware attack. And what happened was millions of Americans could not get their prescriptions because the pharmacy never received the prescription. Hospitals and doctors did not get paid because Change Healthcare could not execute that transaction. Small rural hospitals many of them went out of business because they had a daily bill. They had daily expenses of $1.5 million, just a small rural hospital. yet no money was coming in. How long is that sustainable? So just taking that one. So the map, what am I talking about? Can we map out all these important, these essential healthcare workflows? Retail pharmacy, I just described that to you. Medical imaging, blood supply and distribution, pharmaceutical and medical device manufacturing. There's a complex, it's like a board game. To complete a workflow from beginning to end, it takes a number of hops. And each one of those hops is a technology, is a communications, is a software, platform, or service, all of which can be vulnerable to cyber attack. And so if you're a hospital system or a pharmaceutical manufacturer, you look at this map and you ask yourself, who's doing this reimbursement service for us? Who's doing this imaging diagnostic service for us? And what is their relative importance? What is their material risk to the successful completion of this workflow? Okay, this one is high risk. No, this one is high priority. And what's their risk? Well, we have this service provider. We know they're not up to snuff in their cybersecurity controls. Or this provider has concentration risk. Like Change Healthcare, there's only about three organizations that do what they do. That means you don't have any alternatives. If you're a small hospital,
that essentially makes a private commercial company part of the critical infrastructure.
That's right.
Simply
exactly.
Because there's nobody to take over in an emergency.
Exactly. So we're trying to map that out. We have 17 workflows. If you go look at the toolkit, there are 17 workflows that any healthcare organization can look at and see, where do we fit in, or where do our suppliers and technology providers fit in? And then we can build a risk profile and prioritize that and know where we can invest our dollars on the highest priority risks. And the lower priority risks, we know we can get some backup there. Now, the government looks at these maps and says, okay, just as you said, Paul, there is this large community of technology and service providers that are not regulated, but nevertheless serve critical infrastructure, are therefore part of the critical infrastructure. How do we hold them accountable? What kind of monitoring can we do of this global supply chain system such that we can hold these providers and technology companies accountable?
And a good example.
And what's the policy and political implications of that? In this country, when somebody starts arguing for regulation in this country with this administration, you're probably not going to be very successful when you talk about a regulatory environment. So you got to even take politics into it.
Yeah, I guess we can all react to the politics, but we have to look across the ecosystem and look at the risk and do what we can. And I think in a really good example thus far, so in 2015, FDA started regulating and requiring software bill of materials, and also, before you release your medical device to market, you need to demonstrate your mitigation strategy against all the vulnerabilities. And that gets to sort of the supply chain question, at least for the medical device manufacturers, who, in addition to them, they have their own suppliers. They have the open source software they incorporate. They have third-party components that they get from other software vendors, and they themselves manufacture portions of the system they produce, at least from the software perspective. And so that process works really well because everybody knows that they need to generate and understand all the software components that are in their system. They need to share that software bill of materials with the healthcare providers themselves so they know what they're receiving and they can diagnose things should an event occur. And they need to do an ongoing, continuous assessment of the vulnerabilities inherent in those medical devices and take mitigation actions. And so that, without that, I'm not sure all these organizations would necessarily do it. We do think that would naturally be considered good business for a medical device maker. But we did a survey last year at RunSafe. The healthcare And I see this as an encouraging statistic, but it's also, you can look at it slightly differently. But the Medical Device Cybersecurity Index we did last year, interviewed hospital systems and medical device makers and related folks, and had specific questions around cybersecurity. And one of them is that 46% of hospital systems declined to purchase a medical device due to the cybersecurity concerns. So I do think there is some market forces there, but I also think there is a role for regulatory, side of it. If we just left it to market forces, the other 54% wouldn't care. And so I think 46% is a great statistic that encourages the change. And if the major manufacturers of medical devices are taking actions, then that's doing great wonders for the resilience of our healthcare system. But we still have a ways to go. And especially in light of the fact that 22% of healthcare organizations experience cyber attacks on medical devices, also from our cybersecurity index. So I think that the need is high to address cybersecurity. I think if we leave it to market forces alone, we won't get there. We'll be 54% short. And I do think, one good thing that is happening from the EU Cyber Resilience Act is global manufacturers of medical devices are building in security protections into their device and are being held accountable if there is, in fact, a vulnerability that they did not address. And those global manufacturers who are working feverishly now to catch up to those regulations and make sure they're, on point, are doing that for all their devices, not just the ones they ship in the EU.
Yeah.
Joe, it's interesting that 54, 46, those numbers, they're pretty much half and half, which kind of suggests that there is an equal role for, as we like to say on the podcast, the stick and the carrot. That market forces are really helping. In other words, hospitals are saying, you know what, if you're not up to scratch, we won't actually buy your product. We'll prefer your competitor. So bring yourself up to scratch if you want to stay in the market. And then we have things like the liability regulations, notably in the EU Cyber Resilience Act, that say, if you don't do the right thing, then you can't sweep it under the carpet or just say, oh, well, cybersecurity trouble happens. It happens to everyone sooner or later. There will be consequences. There will be some liability. So think about it well in advance.
And across the product manufacturers, there's kind of 5 criteria for when cybersecurity controls get adopted. The first one is industry requirements. The second one is corporate governance. The third one is if there's advanced persistent threat that is, providing some form of existential threat or real risk to their devices themselves, a hacker group targeting those devices. They have to react to that when it comes up. The fourth one is customer requests. So that's fourth on the list, is what drives security adoption. It's after industry requirements, internal governance, and APTs. Fourth on the list is customer requests, and then fifth is differentiation. So that shows the mindset in which a manufacturer who's making these products goes through in considering what are my priorities from a cybersecurity perspective. And they themselves have to answer, what is the profit and loss margin on my products to help make that decision. It's not just an easy decision. They have to look at the overall cost structure and profitability of their devices.
Yeah, and the customer request issue is an interesting one, because you could say that there's a large number of health systems that would not request cyber security in medical devices if it costs more. And so the cost of cybersecurity being built into medical devices needs to be built in as well, which is why we, in the Cyber Working Group, one of the values of what we provide is that we serve as the forum for those customers and providers to come to the table together. So one of our flagship products is called the Medical Device Joint Security Plan, first published in 2019 and again in 2023 as an update. And this, why is it called the Joint Security Plan? Because it was major hospital systems sitting down with major medical device manufacturers at our table in the Cyber Working Group and considering how do you design and build and test cybersecurity into medical devices from the ground up as a product lifecycle enterprise. What should the health system expect from the medical device manufacturer? What can the medical device manufacturer be accountable for? Taking into account what you referenced earlier is every medical device can have hundreds of different components and software programs built into it from third parties of those medical device manufacturers they don't totally have control over. And at the same time, you have hospital systems. When I came into this in 2017, I saw a lot of circular finger pointing where the hospitals would say, quit selling us junk to the medical device manufacturers. And the medical device manufacturers say, we are building the security that you demand from us and that is required of us from FDA. And there's a lot of other parts to this that we don't have control over. But by the way, hospital, fix your crappy architecture. Stop using password as your default password. And then they go back and say, yeah, but some of your passwords are hard coded. We can't change them anyway. So it just went around and around. And so we bring them together and say, okay, let's do some myth busting here. And let's learn from each other's business models. Why do hospitals have the problem they have? Why do medical device manufacturers have the problem that they have? And it's not as simple as the other side thinks. So it was very instructive for both sides. And then what we created was the medical device cybersecurity, the joint security plan. Following on the heels of that, it was a model contract. Big healthcare systems and big medical technology companies sit down and say, why don't we negotiate a contract template? Covers, let's say, 80% of the most commonly used cybersecurity terms and conditions in a contract between a med device company and a hospital system. If it's good enough for the big hospital systems and med tech companies, then it ought to be scalable down to it's like 34 clauses, 35 clauses about what's expected on both sides, right? Both sides. It's a shared responsibility. And then you mentioned FDA. You're absolutely right that market forces alone can't handle these complex and evolving issues, nor can regulation alone handle these complex and evolving issues. But FDA was given authority by the U.S. Congress 3-4 years ago, I think it was 22, to include cyber. So normally when FDA is looking at a medical device, they're looking at its safety and effectiveness. I think those are the two terms being used. Does it do what it says it's supposed to do? And does it do it safely? I stick a medical device, an implantable into my body. That thing better not malfunction. Otherwise I croak. Now cybersecurity is a part of the calculus of what is safe and effective. Isn't that interesting? So that was FDA by the Congress was given that authority to then assess when a medical device company comes in with an application. Here's our new cool thing. FDA will assess that device on a whole range of safety and effectiveness measures, including cyber. So that's an evolution of good regulation, I think. And if you ask a lot of the larger med tech companies, they say, yes, we do need a minimum level of cybersecurity controls because we need to have a level playing field. When you have smaller med tech companies that are not doing that, that's harmful to the ecosystem.
Greg, can I just ask at this point a question about something that is effectively the elephant in the room, if you like, in healthcare, perhaps, that we've already touched upon, and something that can actually cause massive healthcare disruption, even if there are vulnerable medical devices, and yet even if those devices don't get attacked through those vulnerabilities, and that is the terrible problem of ransomware, simply because of all the organizations you can think of, something like a hospital is in the least best position to deal with an outage, and therefore gets targeted by cyber criminals who, for all we can see, are in it for the money. whether they're in it for their own aggrandizement or whether they're in it for money for a regime that is otherwise sanctioned. So where do you think we're going with ransomware in the healthcare industry? You already mentioned that case of Change Health. They got ransomwared, and that had a knock-on effect to pharmacies, to hospitals, to GP clinics, to patients, to everybody. Where next with ransomware?
I think it remains the gift that keeps on giving for the hackers, particularly for healthcare, because they know that hospitals, will be given the choice. Do you want to continue to serve your patients? Okay, then it's only going to cost you $1.5 million. You don't want to pay the $1.5 million? Well, then you've made the decision that your hospital is possibly going to go out of business and patients will be harmed. Take your choice. So as long as that calculus remains, I think it is a business model that works for the criminal groups. They even have 1-800 call centers, the 800 telephone line. You don't know how to use Bitcoin. Well, we have assistants over here standing by ready to help you deposit your Bitcoin into our bank account. But it's...
They even come up with special names for their work these days.
Yeah,
like
absolutely. There's special names for their groups.
Post-paid penetration testers, as though their work is entirely legitimate.
Yeah, they got a good HR department, human resources department. But particularly for hospitals, for any enterprise, most cyber attacks are successful not because they're doing sophisticated, medical device hacking. Medical devices are really not that are not that targeted. It's usually in your email systems. It's usually a ransomware attack is successful because of social engineering. I get an email, it looks legitimate. Maybe it comes from my boss, but it doesn't come from my boss. And the boss has told me to open up this attachment. Here's your performance appraisal. And that's not my performance appraisal. It's loaded with malware, and that is the access point. So, training is training and practicing and training again and exercising, building muscle memory against these at the user level might be the most effective defense, because that remains one of the most successful attack vectors. That's social engineering. A couple of others are unpatched vulnerabilities anywhere in your IT stack. And the other one is any kind of internet-facing tools that you have that can be vulnerable. And then I think another common attack is your supply chain. Supply chain meaning you get a software update from your service provider. This happened several times in the past where the software provider had been hacked and malware was installed on their software update. And with one click of the mouse, that software update goes out to your 10,000 customers. That software update, infected software update, is going out to your 10,000 customers. With one mouse click, you've just infected 10,000 organizations. And you accept that.
Given that many healthcare operators, particularly hospitals, and particularly, as you've said, rural hospitals, and certainly hospitals and clinics throughout the developing world, really struggle for budget. And nevertheless, they need to have high uptime. They can't afford to say, well, let's replace a quarter of our laptops, and maybe if they don't work that well, then we'll switch them out or send people to fix them. They're kind of fighting this battle between operational continuity and being at the cutting edge in terms of software and the hardware and user training. How do you reconcile those problems where you want to get ahead, you want to go ahead, but you don't have the money, and you may consider it a terrible risk to try and change too much at the same time in case the safety and the patient care aspects fall apart anyway?
Yeah, that's an existential issue. And now, you may have heard of this artificial intelligence agent called Mythos, which is made by Anthropic. And they,
Yes, it's every third news story has that word in it because it's
yeah,
great for clickbait, even if you aren't interested in AI.
and it is scary for not just the small hospitals, but for the maybe even more so for the larger ones. Imagine, I mean, in very simple terms, Mythos can find vulnerabilities in software that no humans have found, no groups of software engineers have found those vulnerabilities. Mythos has, and out of that vulnerability discovery comes the need for patches. Now, imagine if you're the CISO for a mid-sized or small hospital in rural Ohio, and all of your vendors who you buy from install their technology or medical devices, you are getting bombarded with patches that you need to high priority, high risk severity patches that you better install them. How do you do that in a sequential and prioritized way? And often with a patch, it means at some point you're going to have to reboot your equipment. And rebooting means if that medical device is attached to a human being, how do you deal with that when it goes off and then on again? So those are, yes. So the operational continuity issue and the difficulty of that continuity requirement now, given this AI, I mean, on the one hand, it's great because they're finding vulnerabilities. On the other hand, it's resulting in a flood of patch requirements. And eventually those vulnerabilities are going to get out into the wild, and they may be exploited before I have a chance to patch that vulnerability. So
I think we've actually reached a point of no return on that, in that we cannot keep up with patches in a manual fashion, patch by chat patch at AI speed. And if AI is identifying vulnerabilities and writing exploits faster than we can patch, we have to rethink the process. And it comes back to the software development process. It comes back to what you put into it. And quite frankly, we need a silver bullet here that eliminates entire classes of vulnerabilities, as opposed to the exhaustive, cat and mouse game trying to keep up with AI, which humans will lose. And in fact,
maybe
I
that
only
silver
know
bullet
one.
is AI. I mean, AI, the software developer, right? So then it becomes machine versus machine. AI versus AI is what we're going to be facing.
Yeah, and at RunSafe we have a different opinion. We take off entire classes of vulnerabilities from cyber attack, even if a patch is not available. And that's a deterministic thing that can pass those safety measures across these industries, including the safety measures in medical arena. And I do think AI is helpful, but if we simply, it's almost like a digital Cold War at that point, and no one will ever keep up and will always be one step behind the latest release of the AI engine. And so I think we have to rethink the model altogether for that reason. And that's in part why RunSafe exists. We think these medical devices should run safe, regardless of whether a patch is available.
Yeah. Yeah.
Joe, because whether it's AI versus AI or human versus AI or human versus human or whatever combination, if you're continually having to deal with threats by making changes to your network and to your devices all the time, if we get to the point that even things like blood infusion pumps or things like drug infusion pumps are getting patched 7 times a day like your favorite web app, then we're running a great risk that no matter how good those patches are, we're going to affect that operational continuity, and we're going to start having great security but maybe poorer safety. So
That's
we
right.
do need to approach this from all dimensions, don't we? Just
Yeah,
continually, just patching faster is not good enough on its own.
in part because you have to test every patch still,
Yep.
Yes.
and
Right.
you have to deploy it, like you say. So can the hospital systems afford the downtime to apply all these patches? No. And with an exponential increase in vulnerabilities, it's an impossible task, and it puts the sector at risk.
Yeah, and one of our priorities for the year, we have a 5-year cybersecurity strategic plan. The strategic plan boils down to 12 implementing objectives. I believe it's objective number 12 that calls for an environment, a culture of mutual aid, mutual assistance, meaning that you have healthcare systems in a region, in a state, large and small. Is there a way that they can better pool resources, whether it's left of boom, meaning the preparedness side, or and that means patches and costs and downtime mitigation, or right of boom, incident response? And where does the government play in this? For those small rural hospitals, what kind of grant money can they apply to enable those under-resourced systems to be able to invest in technology and in the patching and in the maintenance that will minimize downtime, financial loss, safety risks, all of these things, and to have it as a culture that is not siloed and we're in this alone. No, none of us is as smart or effective individually as all of us are collectively. And so we're trying to
Greg,
build
I'm
initiative.
conscious of time, so I
Sure.
of need to wrap things up now. And I think you've brought us to a great point by talking about culture, by talking about working together. And as Joe knows, I do tend to like to finish on cliches or truisms, and they're only truisms because they're true. And once again, this just reinforces that idea that cybersecurity really is a team sport. It's not an individual game. And so it's almost, would you say, a sense of ask not what healthcare can do for you, but what you can do for healthcare. No one person can solve this on.
Yeah, and that is really the motivating factor behind the Cybersecurity Working Group. We have today 10 task groups on different areas, such as artificial intelligence, such as another emerging problem, post-quantum cryptography, about workforce development, how about cyber updating and patching, bringing together the experts and their senior management to consider some of these problems. And they are coming to our table as a contribution to the sector because they know, and sometimes just to learn something, to get better themselves. But they know that if they can do anything to reduce risk in the broader ecosystem, because we're so interconnected, they are reducing risk to themselves. And that is informed self-interest. And if you want a truism, one of my friends from the past, the former NSA director, Chris Inglis, said it best when he spoke to us about this mutual aid. He said, in order to beat one of us, you have to beat all of us. And that's the sense of, Three Musketeers, all for one and one for all.
So, Greg, before we finish, just give us the URL that people can visit, for example, if they want to learn more about SMART, for example.
Yes, go to healthsectorcouncil.org. And you will go through the publications tab, and all of our publications are there. They are free. They are free to use. They are not copyrighted in any way. And there's a search bar. And if you want to look for SMART, just type in SMART. If you're interested in joining the Sector Coordinating Council, it does not cost anything. The cost is sweat equity. Come to help work. There is the contact page. If you're interested, go to the contact page, put in your information, and we will get back to you.
Excellent. Greg and Joe, thank you so much for your time and your passion and your thoughtfulness, and that idea that this is, really is a question of all for one and one for all. That is a wrap for this episode of Exploited, the Cyber Truth. If you enjoy this podcast and find it useful, please subscribe so you know when each new episode drops. Please like and share us on social media. So thanks to everybody who tuned in and listened. And remember, stay ahead of the threat. See you next time.